Our next speaker will be discussing stroke prevention. Professor Gary K.K. Lau, Clinical Associate Professor from the Department of Medicine at the University of Hong Kong, will be talking about incorporating multimodal data for stroke prevention and management. This time, please welcome Professor Gary K.K. Lau.
Thank you. Thank you so much, first of all, for inviting me to this wonderful conference. In the coming 20 minutes or so, I'll share with you how we can potentially incorporate various sources of data and then into stroke prevention and management. I'm a clinician, so I'm perhaps slightly out of place here, but I think we do need to work very closely with radiologists, engineers, right, to see how we can take things forward. I am engaged in a number of startups and also different projects, and here are some of my disclosures. Traditionally, stroke prevention and management, these are some of the data that we use from demographics, vascular risk factors. We now have stroke riskometers, imaging, right, and of course assessments from therapists. But of course, these are often at time sort of snapshots in time, and hence, but then despite current preventive and management strategies, we all know that the burden of stroke remains to be highly sort of significant. 1 in 4 adults globally may have a stroke in their lifetime. It's a major cause of death, disability, dementia, right? And also we have an increasing incidence of young stroke. And of course, we know that a lot of these strokes are actually sort of preventable. And despite all of these preventive and management strategies, many people who come in with a stroke, have poorly controlled risk factors or newly diagnosed risk factors, 1 in 8 develop another stroke within 5 years of the first stroke, and hence that creates a lot of opportunities of integrating multimodal data where we can have sort of personalized, holistic clinical care, through improved detection and optimization of risk factors, patient stratification, ultimately, of course, to improve patient care and outcomes. I'll share with you a number of different examples in the coming 15, 20 minutes. Of course, with digital health. Here is some of the most significant risk factors for stroke. And you can see blood pressure, hypertension tops them all. We know that 1 in 3 adults, globally, age 30 to 79, have hypertension. A lot of them are not aware they have the condition, and only 20% have it under control, But of course, this is the most important modifiable risk factor for a stroke. With the advances in digital health, with smartwatches, we can now use the optical sensors, to detect, the pulsatile changes in blood pressure, using the PPG. And of course, there are limited smartwatches with inflatable blood pressure cuff. Of course, this will provide improved opportunities for improved diagnosis, treatment of hypertension, now that we have dynamic sort of readings, not just simple snapshots in time when the patients come into the clinic or healthcare setting, I think this then provides improved diagnosis and treatment, but also optimization of antihypertensive therapy as well, because we have continuous readings, and we know that blood pressure variability is a significant and independent risk factor for stroke, independent of average blood pressure control. These are the 2 main modalities, PPG and sort of cuff-based, and you can see that some of them, are FDA approved, and you can see some of the pros and cons of both of these different devices. Another important risk factor is atrial fibrillation, where one has an irregular heartbeat, and that also increases the risk of stroke. The risk increases with age, many of which are asymptomatic, but those who have AF, the stroke risk is 5 times compared to those without AF. And a lot of these, of course, are preventable with use of direct oral anticoagulants and then so on, And again, using smartwatches, this now provides a new paradigm for AF detection, Again, using the PPG, you can have the possibility to catch intermittent asymptomatic AF, and of course also provides opportunity for early detection and prevention. And there has been large studies, over 400,000 sort of participants, and you can see the sort of very high positive predictive value for detection of AF in both of these. But there are, of course, caveats, with use of digital health for AF detection. We know that many of these are used as a screening tool and not diagnostic, right? And you do sort of, there's of course potential for false alarms, and clinical significance of very short and frequent AF episodes are still being researched. And hence, these are some of the future directions, in terms of identifying the patients who will most likely benefit from ambulatory monitoring, We don't know whether sort of increased detection of these, will lead to increased appropriate anticoagulation prescription or lowers the cardioembolic stroke risk, and then hence there are ongoing large-scale studies, looking into these issues. Also to do with blood pressure and sort of biometrics, some of you may be aware of this startup, Panoptic, which is a spin-off from UST, using the front-facing camera of a phone, to detect biometrics of an individual, And you can see here, this is a short video of how this is done, and you can see that in less than 30 seconds, the Panoptic AI and hence able to sort of the RPVG technology, detect, and sort of a number of biometrics data, and the pulse rate, has been FDA approved, You can see this video, of Carl, which is the CEO of this company, and you can see some of the measures that can be detected. I won't go into the background in too much detail, but you can imagine a lot of AI algorithms, machine learning, to come with these different sort of outputs, and of course imaging and sort of analyzing the pulse wave analysis, and sort of the pulse transit time as well, and hence you can see how these sort of in terms of the different biometric monitoring, and sort of the FDA clearance of the pulse rate. We have been collaborating with Panoptic, because we wanted to see, how this platform fares, in the community dwelling cohort, This is still work in progress. We looked into sort of middle-aged individuals, About 1/3 had hypertension, and as you can see, the pulse detected by Panoptic strongly correlates with that with blood pressure monitors in a research clinic setting. And indeed, as mentioned, this has already been FDA approved. We also looked into about blood pressure sort of detection, and you can see here that for the correlation seems to appear stronger in those with normal blood pressure. But those with higher blood pressure, the correlation seemed to be a bit weaker, But I think we do need to sort of continue with the work, And hence whether this platform may be potentially useful for those with, versus no hypertension. You may be aware that some smartwatches, devices nowadays gives you a notification, whether the patient or individual may have hypertension or not. So I think this may be a potential use. The correlation with diastolic blood pressure is weaker, and this is in a sense expected, because of the differences in the physiological differences in systolic versus diastolic blood pressure, and how the waveforms are captured, and analyzed, But again, this is work in progress. But with a digital phenotype, we know of the significant advantages, We have the unprecedented temporal resolution. We can capture real-world physiology. But here are some of the disadvantages. A lot of data, How can need of validation, for clinical decision-making, regulatory hurdles, data privacy, and so on. I'm sure imaging, will be discussed a lot in this conference, but these are some of the key sort of parameters or sort of modalities that we use day in, day out in a clinical setting, in, of course, MRI, looking at the vessels, tractography, but also, in terms of looking into sort of amyloid burden for patients with dementia and so on. And we have a lot of experts who will be sharing with us later on CEST imaging, low-field MRI, and then so on and so forth, But I'll just to share with you how incorporating sort of simple imaging techniques can help us clinicians. This is something, many of you will be familiar about epilepsy, but actually epilepsy also is quite common after strokes. About 8%, in stroke patients after in the first 5 years would develop post-stroke epilepsy, and hence, identifying those who are at risk may facilitate monitoring and patient empowerment and counseling. So our team, in collaboration with MGH, and other hospitals, right, we looked into whether we can incorporate imaging, right, using MRI, right, and you can see there's various parameters, right, had value, right, to help predict one with sort of post-stroke epilepsy. And you can see here the area under curve, right, which was quite significantly better compared to previous risk scores. But interestingly, right, I think hemosiderin, we learned actually some parameter or some in the brain is actually very sort of epileptogenic, right, and this is something that in the risk score was different compared to other sort of risk scores. But we are doing sort of further studies, right, looking into whether incorporating other imaging information, right, can also help to improve the risk prediction and so on, right. I'll go briefly into sort of post-stroke functional recovery. We know that actually a lot of patients require rehab, not just stroke patients, but also those with Parkinson's, geriatrics, right? And actually with the aging population, the numbers will keep rising, right? And actually a lot of the unmet need in rehab, right, is in Asia and also in sort of low middle income countries. We did a global survey, right? And actually even in Hong Kong, we lack the facilities, we lack trained professionals, right? Traveling time between facilities and home, right, is high, right? So, hence, I think, especially in the era of COVID, right, telehealth has been a very sort of emerging modality to see whether this can be looked into. And of course, different modalities from asking patients to watch videos, right, but we know that it's very difficult to monitor the compliance and sort of provide feedback, right, because you don't even know whether they're following the instructions or the videos correctly or not, right? Video conferencing, right, research-grade sensors are very difficult to scale up, right, because they're very costly and as well, right? And hence, we actually, right, also worked on a platform, right, to see whether we can use the front-facing camera of a tablet device or mobile phone, right, and using really simple sort of AI technologies, like computer vision, to see if we can monitor the sort of movements, right, of the individual, and hence facilitate telerehabilitation in the home setting, right. So I think this also started during the COVID era, right, but it has gained a lot of interest, right, internationally, right, and just to walk you through how the platform works. The therapist would be assessing the individual and prescribing, right, a sort of tailor-made home exercise for the individual. The individual can then sort of load up the exercise at home, right, and follow the exercises. And with the computer vision, right, and AI technologies, you can then monitor whether the individual is doing the exercises, whether there's any doing correctly, providing feedback, right. The therapist can also, right, see the sort of whether the quality of the movements, right, at their sort of portal, and hence facilitating rehab. This was started, it was a side project of ours, right, but actually it has gained global interest within a very short period of time. But also, right, on the area of AI and sort of rehab, other than physical rehab, I think other things, speech and swallowing, etc., this is also important for many patients. And using AI to facilitate, right, speech and language rehab is also something that we have been working on. This is actually some work by some of our students, medical students, and also some recently graduated speech and swallowing therapists. But ultimately, right, incorporating multimodal data from wearables, right, to imaging, right, I think ultimately we want to see how we can sort of drive personalized rehab and sort of to facilitate individualization. I think this is very important. Also, right, from daily sort of behavioral and environmental phenotypes, capturing daily life is very important, because we know that I shared with you this graph already, but right, many risk factors for stroke are associated with diet, as you can see here. And the other half, right, or other bits are related to air pollutants. So, right, can we use, how can we adopt or incorporate some of these into better risk prediction or sort of, or improving the prevention of stroke? Because I think, first of all, right, we are what you eat, right? And of course, we know, right, there are many different ways to capture diet, and many of these are done on sort of in a research purposes, looking into food diaries, dietary recall, but very, very labor intensive. And a busy clinic setting, right, when we on average have 10 minutes, right, with a patient, right, when we have to go through a lot of different things from the symptoms, occupation, social history, etc., lifestyle, etc., we really can have very difficulty going through sort of their lifestyle, etc., in great detail. And this is is also some work, right, that we're involved with, but also driven by some of our medical students. How can we use a camera and a phone, right, to capture, right, for example, a dish, right? For example, you may be eating fish and chips, for example, and you take a photo, right, and it will give you, right, roughly the sort of calories, right, in terms of the sort of salt or the fat intake and so on, right, and to help, hopefully, right, modify the behavior of an individual. And hence, right, these are some of the things some of the pros and cons of these sort of technologies. We have also been looking into sort of air pollutants, right, and also we know that this is an important risk factor for strokes, and also for different stroke subtypes and severities and so on, right, and hence definitely areas that can also be considered. I think in the final few minutes, right, I just want to share with you, right, other than what have been mentioned, of course, in our locality, right, traditional medicine is important, and also a lot of wisdom from traditional Chinese practitioners. This actually came out just last year, right? We know that when a Chinese practitioner looks into the pulse and the waveform, actually the information they capture is actually quite different compared to, and then sort of often a time a lot more compared to Western practitioners, right? And there has been a lot of engineering work looking into see whether using sensors you can look into these into sort of more detail and infer some of what the patient may sort of be having from the Chinese medicine perspective. And I think this was something, again, I was involved in recently, which I felt was very innovative as well. I shared with you using a PPG sensor how often a time, right, from the Western medicine perspective, capturing into blood pressure, the pulse, right, looking into atrial fibrillation, etc., right. But this company, right, looked into, in collaboration with many different Chinese practitioners and integrated medicine specialists, right, seeing whether it can capture additional information. We know that the organ systems, right, from a Chinese medicine perspective is often a time very different compared to Western medicine. So I think these are some of the potentials of using PPG sensors as well, and we've been involved in validating this from a Western medicine perspective. We know that there is a lot of advantages, right, and sort of how we can integrate holistic patient assessment and also integrating medicine from Western and Chinese medicine. But of course, right, the validation curve is steep, and of course, we do need further clinical trials and so on. So in the past 20 minutes or so, I've gone through quite quickly, right, in terms of the range of digital health and sort of solutions or sort of new different gadgets, right, which as a clinician, right, many of which we are gradually adopting, right, many are evolving and needs more validation studies. And you can see here we've shared a number of examples, right, using digital health watches, right, for blood pressure monitoring, right, pulse, atrial fibrillation detection, right, to sort of a Chinese medicine perspective, right, to a camera on the phone, right, or tablet device, right, to also facilitate biometric monitoring, right, but also to help with rehabilitation and so on. But of course, right, imaging, right, to understand the brain health of an individual is extremely important, right, as we talk a lot about dementia, strokes, neurodegenerative diseases, right, how we can incorporate many of these different technologies together to really help facilitate treatment for our patients. So being from a more reactive approach to being proactive and predictive. From episodic sort of snapshots in time, right, when patients come into the clinics or healthcare settings, but having more sort of continuous sort of data monitoring and being more context aware. And in contrast to having a one-size-fits-all, right, to having a deeply personalized measure. And of course, ultimately, right, from siloed to integrated sort of approach. So with that, thank you so much, and I do look forward to sort of more interactions and discussions in the coming 2 days. Thank you very much.
Thank you, Professor Lau. Please stay with us. Now, I'd like to invite Professor Kenny W.Y. Chan to come on stage and present a souvenir to you as a token of appreciation.